Hi, everyone. Thank you for joining us today. We are now in our fifth part of our series of the Future Global Health Leaders Program. We're going to talk a little bit about what Global Health Technical Professionals is, and we'll get into the specifics of the program. But we want to make sure that we have a lot of time available for Q&A with our audience. So my name is Stacy Terrell. I serve as the Diversity and Inclusion Manager for USAID's Global Health Technical Professionals Program. And we just want to give a brief disclaimer that the materials that are here are obviously authored by our program. We're not intending to speak on behalf of the US government or USAID specifically. So just in terms of our agenda, we'll be starting off with an introduction. We'll be getting straight into Q&A, and then we will open it up to questions from the audience. So we can either have you unmute, but it's preferred that you just submit your questions via the chat. We're going to try and get to all of the questions that we can today, and we will be recording this, and we will be sending out the recording of this webinar hopefully within the next week or so. So to start off, we just want to make sure that you are aware of what USAID is. So USAID is the U.S. Agency for International Development. It operates in over 100 countries around the world, and it is basically the U.S. government's arm for doing international development and humanitarian assistance work. And we definitely want to make sure that you know what GHTP is. So GHTP is the Global Health Technical Professionals Program. We are a USAID-funded program that's designed to connect global health talent with career opportunities at the agency. Because we are focused primarily on the early to mid-career range, we do provide professional development guidance and funding to all of our participants. And we also have a mentorship program that we operate through our program. So all of the panelists that you'll be hearing from today are all part of GHTP. And specifically, we wanted to talk about what our Future Global Health Leaders program is. So as a way for us to really make sure that we're tapping into the large community of early career or student professionals around the country, we created the Future Global Health Leaders program. And this is really just a way for us to engage and offer career counseling. We have one-on-one time, so you can sign up for our office hours that we host every week to get any questions answered that you have about global health careers. And we also have a toolkit that we share with our network. So if you have any questions or want to sign up to hear about more events like this, you can sign up at the bit.ly that's located on the screen. And just wanted to make sure that you know about what are all of the career options that are available to support USAID. So again, all of our panelists here are a part of GHTP. So they all fall into the contractor employees category. There are a lot of ways to support Global Health Bureau and other supporting bureaus within the agency's work, including some of the mechanisms below. So you have internship opportunities, fellowship opportunities, personal services contractors, and direct hire employees. So we wanted to make sure that you knew about the breadth of possibilities that are available. But again, today we are going to be speaking specifically from the perspective of our program. Many of the panelists have maybe been in different varieties of hiring throughout their career. So they're going to be sharing their individual experiences. And now we will get things kicked off with just an introduction. So we'll be starting in alphabetical order with Burke Betts. He is a key populations data and visualization analyst. He is based in the Global Health Bureau in the Office of HIV/AIDS, Priority Populations Integration and Rights. And then we have Juan Flores. He is a data analyst. He works in the Global Health Bureau as well in the Office of HIV/AIDS. You'll see a theme here and he supports supply chain for health. Lastly, we have Geraldine Hoover, who is also a data analyst. She is also in the Global Health Bureau, Office of HIV/AIDS, and she is in the Systems and Program Sustainability Office. So we'll start in alpha order, and we can kind of switch it up so no one feels pressure to be first on the questions after that. And we will kick it off with hearing on the first question of how did you first become interested in data analysis or data visualization? And we'll start with Burke.
Thanks, Stacy. I really first became interested in analysis and visualization while doing some work and living in South Africa as an undergraduate student, and trying to find a way to be part of solutions kind of after I had come back from being in South Africa, and identified really public health and epidemiology as an area where I thought that I could participate in solutions and providing assistance to communities based on that experience in South Africa. And then I was fortunate enough to land an internship at USAID with the predecessor for GHTP, and it became pretty clear early on that even though there wasn't the same amount of available data then and the emphasis on data that we have today, that data visualization was a way that I could really make myself stand out and perhaps find a future role. And so it was really sort of following where can I be most supportive, not having a medical background, to solutions in global health. Can I move to the second question, Stacy, or just stick there?
Just the first one.
Great.
And I guess next up we'll go to Juan.
Sure, thanks, Stacy. I guess for me, data is I equate to creativity, and I just growing up, I've always valued creativity, the arts. So when I see a beautiful data visual and I react positively to it, it's kind of like reacting to art. So I really just like the chance that I have now to work with data and make sure it's sound, it's of quality, and then produce really great dashboards that tell a story, that get people reacting in all sorts of ways, and hopefully in a productive manner. But yeah, over the years, I merged that kind of more like philosophical interest with, you know, the fact that data is really a tool for driving decisions and providing information to people to improve programs so that ultimately we can improve the lives of our beneficiaries. So data analysis has been it for me, and I love it.
Thank you. And next we'll go to Geraldine.
Stacy, similar to what Juan said, I think he talked about data being used for decision making, but I think you've all probably heard some variant of the phrase data talks or data speaks. And I think, you know, often when there's something that a type of change or an issue in global health that we're passionate about creating change, we have to have data to back it up, and we have to show the information to provide evidence for why that's a necessary change. And I think, so my background is as a registered nurse, and I worked as a nurse in HIV care for several years before going back to graduate school, and then being in my current position now. But I saw so many things as a nurse about the way that we provided healthcare that I found problems with, and that I knew we needed to change. But I realized that to take that personal passion and actually make something with it, I would need to move beyond just, I care about this and this is wrong, therefore it should be different, to be able to actually use information to show why we should be doing things differently and concrete opportunities for how we could make changes to how we deliver healthcare services. So right now, what I love about what I love about my role is I work specifically on data analytics for healthcare workforce issues. So as a nurse myself, I love being able to try and personalize data that we have on healthcare workers to make sure that we're presenting a good story of what these workers that we're supporting through programs are doing and how we can align the investments in healthcare workers with where we need staff to deliver services effectively. So I've loved that combination of things, and that's what got me interested in data analysis, is basically saying, I care about these issues, but I need some hard skills to do something with it. So how can I develop more data skills through graduate school?
So that might be a good segue actually into the next question. So we might start with you, Geraldine, about what is your current role at USAID, and what data skills were required for that role?
Sure. So I mentioned, I guess I jumped ahead next question a bit, but
okay.
I work as a data analyst for healthcare workforce issues within the Systems and Program Sustainability Division in the Office of HIV/AIDS. So it's kind of a big umbrella. There's the Office of HIV/AIDS, and then there's a number of different divisions underneath that. So my division is the Systems and Program Sustainability Division. And the major data skills that were required coming in, I had experience with Excel. I had some experience with R and with Stata, and limited experience with Tableau, all of which I have built more capacity in my current role, but that's kind of where I started.
So we'll go to Juan next.
So what I do currently, so I, as Stacy mentioned, I'm part of the supply chain division, and which is a division that collaborates with Geraldine's division. Well, first of all, our work focuses on making sure that our commodities that ultimately benefit our intended users make it to the service delivery points that we hope that they make. And we look at data from all the way from the manufacturer to when those shipments of commodities are shipped and arrive to the countries, and then ensuring that we have that last mile analytic to make sure that those commodities ultimately make it to the intended beneficiaries. So in my role, I'm working with a growing team of data analysts and data systems folks to provide that intel across that gamut of supply chain activities. So we are currently collecting new data that we haven't been collecting before. We're collecting data at the facility level, which again hasn't really been done before, and that provides us a lot of meaningful insights about how well our programs are working. So in my day-to-day, I work with our data collection partners to make sure that our data is of quality. I then work with our across different teams in our office to make sure that we apply the data analysis methods that are the most meaningful to the intended audiences, and ultimately I get to wrangle with data and get to work with large data sets and try to best create a story with them.
And we'll go to Burke next.
Yeah, so my work at USAID and in the Office of HIV/AIDS falls within this division called Priority Populations, Integration, and Rights. And really what that division is an effort to make sure that throughout all the assistance that is being provided for HIV/AIDS programs, that human rights are not neglected of the beneficiaries, and in particular to look at what populations are often neglected or further marginalized even within existing HIV responses. And so my work is mostly with key populations, which include female sex workers, transgender persons, men who have sex with men, injection drug users, and these populations that are vulnerable not only because of those populations that they're a part of, but often they face stigma and discrimination that really keep them from being able to identify when they're seeking healthcare and disclose what their unique risks might be. And so because of that, the security issues with them disclosing, say, who they are in a health facility setting where they might face repercussions and violence or stigma, we really work to find ways to reach them through the existing healthcare system, but also through tailored key populations services that tend to provide kind of alternative locations for them to receive treatment and psychosocial support that doesn't just include like biomedical interventions. And so my work is really to provide the custom analytics related to those specific populations to make sure that in fact our programs are reaching them and that they are able to access treatment services and prevention services that are tailored to their unique needs, and that they're able to really be tracked across these HIV cascades to make sure that their outcomes are on par or beyond others. And I think that's especially important with HIV because these populations aren't just marginalized, but in many cases, because of the fact that they're difficult to access or difficult to reach with normal programming, they're sometimes how did I say this? There's sometimes the populations that where HIV is spread the most because they're not able to access these services. And so really the skills that I was able to use to get this position and that I use every day, it really starts with data wrangling. That's most often done on my team in either R or in Tableau. Kind of when I first started being involved with USAID and HIV programs, it was all these very epidemiologically oriented statistics driven software like Stata and SAS, and those are used still a lot, and they can be really effective tools. But data wrangling in R and tools like Tableau Prep and then Tableau Desktop, the visualization capacity there, those are what I tend to use most every day. As Juan was saying, providing dashboards and tools that really show the story of what our programs are accomplishing and showing what we're accountable for and how we're improving outcomes for people.
Great. So our next question is, what are 2 career tips that you have for those who are interested in increasing their data skills and finding relevant roles at USAID? So I think we'll start with Juan for that one.
Sure. I think that data analytics has been evolving. It's no longer just ingest data and produce dashboards. I think some critical skills that come with a data analyst or data scientist are being able to engage with stakeholders, being able to listen to said stakeholders and listen to what they're most interested in tracking from their programs, working with them to frame questions of interest, to produce key performance indicators. So I think aside from the data wrangling, the data software skills, there's a human element to it. So I think that when you're writing your resumes or presenting your cover letters, definitely show if you have this experience of facilitating trainings, of facilitating focus groups. Don't be afraid to show that as well. Those are definitely skills that a data analyst also employs in their day-to-day. And then I guess another career tip is to look at available training opportunities. I'm a part of LinkedIn, and through my membership, I get LinkedIn Learning. So there's so many great opportunities to just even get an orientation of a specific data analytic or visualization tool. If money is something that is you're kind of strapped on, then look into your local libraries. They might offer free just professional or just personal development tools, such as data analysis that might get you more, that might get you to hone more of those skills. But I would say definitely hone both the human skills along with the data skills. Those two are very complementary to each other in my experience.
And we'll go back over to Geraldine next.
Suggest, I think the first thing I would suggest is making sure that, kind of also similar to what Juan mentioned, make sure you're able to go beyond just effectively summarizing and presenting data, which are key skills. Like, we need to be able to do that. But what's the so what of it? So like, I think often of meetings that I'm in where, you know, you can present information, but what you then need is, and why does this matter for the program? What is this telling us about the work that we're doing, or ways that we could make changes to that work to make it more effective? So I think making sure that when you're looking at data through whatever types of projects you might be working on in your own time as you're building skills, or through your graduate school experiences, kind of trying to put that hat on of, okay, what would this information tell me, and how might I use that to make recommendations based on the information? So going beyond just effectively presenting data and summarizing it to give a so what. And then the second thing I would suggest is network. Like, find, if you can do internships are great. If you can do informational interviews, just to get to know people in the types of offices or work locations that you think you might be interested in working within. Those have created a lot of opportunities for me in my own career, and people are generally willing to talk with you about the work that they do and learn more about what you're interested in. I think all of us in this room have probably benefited from people who have done that for us, and certainly recommend doing that for others.
Kind of jumping off on that, Geraldine's first point, what I would say is learning to diagnose and then communicate key messages from the data. A visualization dashboard is only as good as the conclusions that you're able to generate from it. And if you're not able to generate conclusions, perhaps it's a absence of the right data, or perhaps it's an issue that you need to learn how to communicate and identify those things better. So I really think that that's a huge element that you can work on. And I think even if you either go to like a looking at an article with a visualization in the media, or looking at something like Tableau Public, a repository of data visualizations. If you look at a visual and there's nothing like clearly presented, nothing annotated in it, nothing that really jumps out to you, even if it looks beautiful, perhaps it just doesn't go far enough. And so you can really practice just in the information that you're viewing every day. And I'd really encourage you to do that as you see visuals, whether it's something like COVID tracking, or a chart about the economy. Maybe it's like GameStop stock prices, things like that. What's the key message, and is it jumping out in the data, and how might you show that better? So I would really push to use an active approach to critiquing visualizations that you see every day. And then I would also say to master an analytic tool, whether it's something like Tableau or R. I think there are a lot of free resources we might be able to talk about later for all of those, as well as, of course, paid ones as well, but there's a multitude of resources. And for finding your way into a field like this, I really think that mastery of an analytic tool just sets you apart. But cheating and adding a third one, I would say maintaining connections to the issues you care about and the people that those issues pertain to, I think is really critical. I know that a lot of you who have interest in global health are probably, you already have that. That's probably the main driver already, but I just can't underscore enough that connection to people that these data relate to is just so critical.
Excellent point. So our next question is just thinking back to your undergraduate or even your graduate experience. What is one thing that you wish you knew about career options in global health? And we'll start with Geraldine on this one.
Okay, got me on the spot. Let's see. I think I knew at the end of my nursing degree, so at the end of my undergraduate, several years before I went back to graduate school, I knew I was interested in public health and that I wanted to do public health work internationally and not just domestically long-term. But I felt like at the time I had a really limited understanding of all of the types of things that could entail. Which I learned more about through graduate school and other work that I did later. I think just there's so many different options. Like you could work with nonprofit organizations that are implementing programs directly in a number of different countries. And there's variance in that. They're increasingly fewer, but there are some roles with those organizations in countries where they're implementing programs. But there tend to be a lot more roles at the headquarter cities where those organizations are based. DC and Baltimore are great examples of where there's a lot of global health nonprofit organizations. And then there's also, there's also work like what we're doing now, what Juan and Brooke and I are doing as contractors for USAID. There's different internship opportunities. I think just recognizing that there are so many different things available. And as one mentor of mine told me once, I think there are very few choices in life and in your career that you can't undo. You can't try something and decide, you know what, maybe that's not for me, or maybe that's not exactly what I'm interested in. Do it for a year or two, and then you can shift and you can do something else. And so that's been helpful to me as I've navigated options and tried to figure out what I wanted to pursue next at each point.
Great. I think we'll go back to Burke.
I think for me, in my undergraduate and graduate studies, I was very research focused. And I don't think that I knew enough about the programs, whether it be USAID, CDC, and all the implementing partners that are working on HIV/AIDS, but also countless other public health problems around the world. And finding an internship at USAID, that was really kind of an eye-opening experience that brought that out. So I think I would just say, taking into account if you're in a research-oriented track, how those skills can be crafted and transformed into something that would be program-oriented as well. And it took me a lot of kind of time and thought, like, oh, do I want to transition to something less research-based? Because I would just really love that aspect of it, but in the long term, I didn't want to remain in academia. So being able to transition to programs provided a really good outlet. And I think that that's just one thing I wish I'd known a little earlier.
Thanks. And we'll go to Juan last.
Yeah, I think this is a great question. And I often introspect and reflect back to my journey. And especially coming from like a first generation background, kind of lower middle income background, I think that oftentimes global health loses its appeal because it's not the most lucrative field. And I just want to encourage people's journeys, no matter what your circumstances might be. If you can't do an unpaid internship, it's totally fine for you to forego that to do something else that pays and provides some transferable skills. And along with what Burke was saying about maintaining connections with some aspect of the global health program that you want to get into, volunteering definitely is a really good alternative to getting that program experience. I volunteered with various NGOs that serviced Black and Latinx men who have sex with men, so more domestic-based programming. But ultimately, I was able to speak to that experiences in my interviews in the end. So be self-compassionate. You don't necessarily have to go through years of unpaid or underpaid opportunities. Sometimes it's good for you to kind of do this kind of a journey. It doesn't have to be a straight career journey. So, but definitely be creative about how you can still maintain connections and kind of maintain the mindset of how I can then transfer those skills to a new opportunity in the future that is in global health. But yeah, I stay true to yourself, and you're already doing a great job.
That's great advice. So we're going to start taking a few questions from the audience. We have a couple in the chat right now. And one of the first ones is, does USAID require technical interviews for data analyst roles? So I think that might mean, are there portions of the interview that will have you do some sort of data analysis for roles?
I think for me, it was more of a sample of work. I'm trying to remember. I think the main part was to provide a sample of previous work. And I'm trying to remember, there might have been a practical aspect as well, where it was like, it wasn't do the work. It was more of a outline how you would approach this process, in addition to sharing that portfolio.
Great. We had a few questions, not to put you on the spot, Burke, that were related to key populations and data specific to that. So there's a question about, do you observe any key differences between the data cascade and analysis for the general populations and key populations? And I think, related to that, somebody asked, your work with key populations cross into the realm of maternal and child health?
Yeah, all great questions. As far as key differences between the cascades for general population and key populations, I think the biggest thing is that the key populations cascades are really incomplete relative to the general population, because as we were saying, people are less likely to be willing to say who they are. And I wouldn't, in most settings, want to disclose something that would stigmatize me or kind of provoke really negative reactions. So I think completeness is a big issue. Without kind of getting into it the data too far, I would also say that there are additional gaps sometimes in coverage of and accessibility to things like viral load testing for many key populations in many contexts. Sometimes there might be differential access to the kind of the advanced treatment and treatment outcome counting that most general populations would be able to get. And one of the things that's been really exciting that I've been able to do at USAID is help lead an interagency, so including CDC process, to develop indicators to supplement the main official data of record that help capture the full extent of services that we're able to provide to key populations through KP-friendly approaches that where they're often receiving care and support outside of facilities. So we were able to really document using an alternative data system the full reach of our programs to help outline where those gaps are between the general population and key population data.
Thanks. And we had quite a bit of questions both in the registration and here around really how, are there any places that you would recommend to get raw and publicly available data to practice cleaning and analysis statistical software? And anyone can jump in and take that one.
A lot of what we use is kind of processed, or at least what I use, can't speak for everyone, is like processed structured data that's already been aggregated at a certain level. I don't necessarily have like access to a lot of individual level data. And so because of that, I think there are some opportunities to be able to pull that from things like UNAIDS AIDS info system for demographic and health outcomes data. By country, and there's some export crosstabs and data that you can use, and then also I think DHS demographic and health survey data are often also aggregated at that at a higher level, and much like the data that we're receiving on HIV/AIDS data sets. So I would recommend that those would be good places to start. We rely on them, I think, a lot less now than we did 10 years ago in many of the contexts that I work on, but like the structure of those data is fairly similar in some aspects to what I work with daily. And then if you're working with Tableau, I believe just even in like the start page, there are mostly like not applicable to health, but useful for learning the visualization tool, a number of data sets that I think are fairly easy to grab and download. And then finally, Tableau Public. A lot of the visualizations that are produced on this online portfolio as a tool for visualizing your data, you can download the whole workbook and it'll come with the data source. So you can just see how others are using a tool like Tableau.
Great. And one person is asking, they have a background in qualitative research, which they think will be helpful in answering the so what questions, but wanted recommendations around getting stronger in management of quantitative data collection and analysis. So there's a lot of conversations about, do I learn R? How do I get, more attuned with using Tableau? So are there any, is there one that people recommend learning more than another, or which one might be a good starting point?
What others think, but I think I would probably suggest, especially if you're newer to quantitative data, downloading some sample data sets like Berg was talking about from publicly available data online, and trying things in the free version of Tableau just to practice with changing data format and structure and visualizing it to show what you want to show from the information. I think R is also really useful for creating a lot more changes in large structure in data sets and creating kind of entering in different types of calculations that you want to do and reshaping the data set and making it look different. And I've used Tableau less for that, but I think I would probably suggest starting with Tableau, but R is also helpful. I think the R Studio, which is the user interface for R, has a number of free intro trainings online on their website, and you could download it and practice doing some basic things as well.
So we have another question about, when you're earlier in your career path, what is a balance of working in a consistent area versus trying to find what area or focus you like to work in? This is circling back to the idea about trying something and deciding later that you may want to switch to something else. How do you present that narratively when applying for jobs later on in your career that may be looking for those specific experiences?
I think that I have a similar journey as what you described there. I initially, just even on my educational background, I didn't major in statistics. I didn't necessarily do epidemiology. I did health policy and management in grad school, and then did a global health track within that. So, but I think along the journey, I made sure to kind of still take research methods courses to kind of bolster my experience in those more program policy related classes. And I think that as long as you make some efforts to show that you have that experience that speaks to the direction that you want to go to, that says enough. And I think when people interview for anyone for any position, I'd like to believe that they're a lot more humanistic and a lot more forgiving of people's journeys and kind of self-discovery. We don't necessarily have this all figured out by the time we're 20 or 25 or even 40, right? This is definitely a journey, and I've seen even people within my office switch kind of trajectories from being more data analysts to more technical and vice versa. So I think bottom line, just being honest in your cover letter about how much you desire to make the switch, and in an interview, just showing, demonstrating that potential that you want to grow in this different area. And showing that willingness to want to grow in that area using the resources that any particular company or office provides is definitely more than enough for you to make the case for yourself.
If I can jump in too.
Go
Sorry,
ahead.
John, go ahead.
I was just going to say to also just be compassionate with yourself too. I think things always make more sense in retrospect than they did in the moment. And I think, I've learned something from each of the things that I've done in the last, however many years since I finished undergrad. And it might not have been what I thought I would learn going into that experience, but in retrospect, I've seen how some of these things have fit together, but you craft the narrative to fit what you've done, and it doesn't always feel like it's going to make sense in the moment. But sometimes it's worth trying something that you think will be interesting or that you might enjoy.
And to add to that, I really liked Juan's earlier example about your career not just needing to be a straight line. It can go in different directions. And I think there's like an added advantage in a field like data analysis and visualization, because whether you want to, you begin involved in it or you add those skills, it's able to provide some sort of a unifying thread. It's the skills that really, in many cases, set you apart. I think as a candidate, and then even if you decide, as I've seen many of my colleagues do, to move from a very strategic information-oriented position into a more program-oriented position, then you bring with you that ability to synthesize and interpret and communicate data, which I think is so crucial at the program level. So I think you can really spin and leverage those abilities and skills that you gain in a field like data analysis and visualization in so many other, I guess, fields and so many other areas of work.
Agreed. We have one question that is related to that, but specific to the nursing experience. So somebody's asking, they also have a background, they're also a registered nurse, completed their MS in global health, and they're having a difficult time marketing themselves in that career transition. So if there's any advice that you specifically have, what transferable skills were helpful for you to get your first role when you made that transition?
Yeah, that's a great question. And I would also emphasize that that has not always felt particularly clear or made all of the most sense. I remember at the end of nursing school, I knew I wanted to do something in public health and not bedside nursing. And I had one professor who really believed in me and went to bat for me to do work with the county health department instead of working in a hospital for my internship. And that meant a lot because I was surrounded by people that were taking a very different path in nursing and in healthcare. I think as far as advice about the career change, actually early on after nursing school, I did some work with a maternal and child health program in Haiti and was working on working as an intern to help support the program and help support a community health workers program. And I really enjoyed a lot of pieces of that, but I also realized after about 6 months of doing that, I realized that as much as I was enjoying those pieces of helping to manage a program and provide support to that process, I was worried that if I didn't have more experience as a nurse within my own profession, that maybe I would regret that someday, or that I would go down a path and then feel like I wasn't actually a nurse because I had never actually worked as a nurse. And so that that for me led me to return to the US to work for several years in public health and community health nursing, which really, for me, at least rooted me in realizing, I really do care about these systems pieces of how we design the way that we deliver health services to work more effectively for the healthcare workers that are trying to deliver those services and for the clients that want services to be responsive to what they need. And so that for me was kind of the driving force of what got me interested in going back for further education to learn more technical skills like data analysis and research skills, to be able to take that drive and interest in how to improve things and how to make things better and put some teeth on it, I guess, and have some hard skills that I would be able to use going forward in other types of roles that I might do. But that said, it's definitely complicated, and feel free to reach out to me by email if you'd like to discuss it more, since I know it's kind of a specific topic.
We have a question that's asking about how do you upskill on the job? Are your colleagues helpful in helping you get up to speed in addition to going for training? So I'll give you guys a moment to think about that, but we did get a couple questions about what roles are available for those who are international students. So I just wanted to share that in terms of our program, Global Health Technical Professionals, because there is a security clearance that's required, it is only open to US citizens or permanent residents. We do have other resources available. We have a career resource sheet that has global health career opportunities that are available for folks who are citizens of any country. And we also did want to highlight that the STAR program, which is another USAID Global Health Bureau program, does have opportunities for folks who are citizens of other countries that aren't the US. Oftentimes, some of their positions that are based overseas are looking for folks who are citizens of the country where the work is taking place. But sometimes their positions are open to folks who are citizens of a different country. So just wanted to put that out there since I saw we had a few questions about that. So back to the previous question about, colleagues being really helpful in helping you get up to speed, and anyone can take that one.
I can start us off. So in our office, at least, we have a lot of great opportunities to learn about HIV programming basics, and just like learning about our work and how it works in different dimensions. And so I think and that experience for me has been really helpful, and as well as for others. In my experience, my colleagues have been fairly helpful in kind of pointing me into a direction, or just giving me some orientation on supply chain. I didn't necessarily have a supply chain background, but they pointed me to resources to learn more about it. And so that was helpful. But I think that the nice thing about my role is that my team is very trusting, and that on-the-job learning is very much expected. We're not going to necessarily come in with the exact solutions to the needs that the teams have. Even if you have extensive data analytics and science background, there's no unless you went to like PEPFAR university or something like that, you don't necessarily have all the tools that will prepare you for your role. So definitely on-a-job learning is expected. And overall, in my experience, when I G-chat my teammates about specific questions, they've been responsive. But yeah, I think that's kind of the nice thing about my role, is that it's been very much, it's been a nice balance of independence, but also knowing that there's a team to back me up.
And I don't know if others want to share. Don't want to keep anyone away from sharing an experience.
I would just second that and say, as a concrete example of that, I had a question a couple of weeks ago about key populations data and was connected with Bork, who was extremely helpful in figuring out the issue. So we connect and ask colleagues questions all the time.
And we did have a question about just if there were any other visualization tools that you would recommend besides Tableau.
I know we at USAID in our office, we tend to use Tableau. It's kind of our platform platform that is most used for visualization. I know a lot of colleagues at CDC use Power BI as well. So it probably depends on what types of things you're interested in, but I think some of the skills would certainly be transferable.
Yeah, I would just say, in addition to Power BI, R in particular, and the various visualization opportunities that you have in ggplot, there in particular, that's the package I would most recommend. I know in terms of upskilling, that's where I've been putting most of my effort, has been into R, to be able to supplement some visuals that may be hard to do in Tableau, or where more data wrangling needs to happen. So definitely recommend that. But it really depends on the agency or organization. We have a partner that uses Power BI. CDC, as Geraldine said, uses Power BI. And so sometimes you might not have skills in the specific software platform, but I think understanding also data visualization theory in addition to basic analytic skills can be really helpful.
The next question is sort of related in that, what advice would you give about working with local implementing partners in the data process? So you'd mentioned you have partners that maybe use a different visualization tool. Are there any pieces of advice, especially for folks who maybe this might be their first time working with local implementing partners?
I think partners, particularly local implementing partners, often they are responsible for collecting and reporting data, but don't often get that back, or don't often have the same tools that the people that they report to have to process those data. And I think that there are a lot of other hierarchical and institutional barriers, such as wanting to protect data security and not share one implementing partner's data with another, that kind of make it difficult. But I would just encourage folks as they work with partners, the suggestion would be to find ways to give data back to those partners where possible, or to if you have time for a more in-depth interaction, for example, on site visits, or more long-term, temporary duty assignments, TDYs that we go on, find ways to work with folks if there's any availability on, here's how we'd recommend visualizing these data. And so emphasizing data use, even if it's not using like a platform like Tableau. Like I went to a partner and was visiting in rural Mozambique, and up on the walls were data in table form on like big pieces of paper that they were using every day to like remain accountable for their outcomes, to make sure that people who they were testing for HIV were getting follow-up tests, that positives were getting reached and linked to treatment. And it was because 6 months earlier, 8 months earlier, another colleague of mine had gone there and said, here's what you should do with your data to make sure that you're optimizing outcomes for the people that you serve. And you need to look at this like every week. And they had been doing that, and they'd been tracking that really robustly. And they didn't need advanced analytic tools to do that. So just meeting partners where they are, and then also you'll find many partners will have a really robust skill. So it just really depends where they're at, but don't let barriers totally get in the way.
Yeah, I second that. I did some work with to help improve, I guess, data literacy among civil society organizations. I think to be able to present data in a way that's consumable by anyone is probably one of the best skills that one can develop. Making sure that everyone knows how to interpret that data in a clear manner, getting rid of the noise and really highlighting the message that you're trying to communicate about a certain visual or a certain data point is the way to go. But if my rule is that if I can't explain it to a 7-year-old and they can't understand, then I'm not doing my job in communicating a data result.
Well, I think we've reached our time, and hopefully we were able to get to all the questions. I just want to really thank our panelists today. Really appreciate you all taking the time out to talk with our guests. We will be following up. As I mentioned, we'll be sharing resources with everyone who is registered for this webinar today, and we will be having the recording available. So thank you so much to everyone who has attended. And again, special thanks to our panelists.